Hello, welcome everyone. So as many of you know, we're doing a fundraiser for Solace Charities. They're based out of Kerala. They fundamentally take care of kids with different types of pediatric cancer, and about 2,000 plus kids are being cared for through medicines and treatment support. ആ ഒരു കോസ്റ്റിന് വേണ്ടിയിട്ട് I just wanted to bring a little bit more awareness into it, and especially about pediatric cancer. So you want to have a conversation with Dr. Yamini Krishnan. She's a pediatric oncologist at MBR Cancer Center in Calicut. She has over 15 years of experience, and she's well known in this field. So welcome, Dr. Yamini, to this conversation. Thank you for joining us. So I wanted to just ask you.
Yeah, thank you.
Yeah. I wanted to ask you about common types of pediatric cancer, and how that's to an extent different from adult cancer and survival rates as you see in Kerala.
So pediatric cancers are different from adult cancers. There's a lot of awareness about adult cancers, like you have lung cancer, you have breast cancer, but very little is known about pediatric cancers. So the commonest pediatric cancer that you see in children is leukemias or blood cancer. So a particular type of leukemia called acute lymphoblastic leukemia would be the commonest cancer that we see in any part of the world. Apart from leukemias, what we see is brain tumors, followed by any solid tumor. As against adult cancers, most pediatric cancers are different in that the types are different. The curability is different. The problems associated with pediatric cancers are different. So it can never be compared with adult cancers.
Yeah, so that's, I was going to ask, treatment options, right? When we talked yesterday also, you said that the treatment option for adult cancer versus pediatric cancer is very different, and that brings up new challenges.
There are some peculiarities about, treatment of pediatric cancers. The most important thing is that very few centers actually deal in pediatric cancers. So most of them are specialized centers, and the duration of treatment, is pretty long as against adult cancers. Adult cancers, usually the treatment duration lasts between maximum of 6 months. Most pediatric cancers, like I said, the acute lymphoblastic leukemia, the treatment lasts for a period of 2.5 years, and 7 months would be heavy, intense chemo, almost daily chemos. In adult cancers, the chemo is usually given every 3 weeks, and usually a maximum of 6 to 8 cycles. So the kind of intense treatment that you see in pediatric cancers are not seen in adult cancers. So the second part of treatment is most of them have to travel long distances to reach a center that actually specializes in pediatric cancers. Very few pediatric cancer specialists are there in Kerala, and most of our patients, especially in Kozhikode, they come from 3-4 districts, because most pediatric adult cancers can be treated in a local oncology center, but most pediatric such kind of intense treatment, they need to travel long distances to take treatment. So that's the two difference. And third difference is the impact on the family, on the siblings, on the parents, because most of them might have to abandon their job to come for treatment. The sibling actually doesn't have anyone to take care of them. So it's not a single person that is affected. The whole family is affected. So
basically with 3 centers, and so families have to now travel and stay, and നേരത്തെ പറഞ്ഞ പോലെ 7 months almost non-stop treatment, right? പോയി വന്ന് ചെയ്യാൻ പറ്റില്ല. So they have to basically stay close to the hospital for that 7 to 8 months or so. What is the financial impact on families, going through?
So what we face in pediatric oncology is one lot of expenses involved in the long distance travel from their residence to the point of care. That is, the travel expenses would be huge for the family. The second is most of them have to have to be accommodated in and around the hospital, because daily they would have chemotherapy sessions going on. So that goes on for 7 months. So they can't just go back to their residence at long distances and come daily. So they have to be accommodated. So the finance involved with the accommodation around the hospital. And third is, since it's an intense treatment, almost daily chemotherapy, the supportive care cost, that is inpatient costs involved in pediatric oncology care, is slightly, higher. Expenses involved to a family is huge in pediatric cancer.
So, but Dr. Solace work, and I think you already know Sheba Mir, so you're familiar with their work. So what's your experience, working with Solace Charities?
So I have been involved with Solace since it's, since they started off. Solace does a lot of, social, help to the family, to the society, actually. And in pediatric oncology, they're doing a big job because one, they do give, apart from, financial help to the medical expenses, that's one care that they do. The second, as I said, the social aspects involved in pediatric oncology need to be addressed, rather than treating the child alone, I feel. So what they do is, they actually help the parents, if they have job losses, they're not able to, pay the rent of the, house they are accommodated in. So they help with, their youth wing is pretty active. They take care of the children. They give them happy moments, as they call it. They give a particular name to it that, it's making the children happy during their difficult times. So they call it happy moments. Then the other thing, very important is they try to employ these parents, especially the mothers. They give employment to them. And of course, they do sibling care also. If any sibling would require some extra help, that way also, it's a total help that they give rather than just medical assistance. And I think in pediatric oncology, that's more important. More than the financial help, the social, commitment that we all should be involved in is to help the family. Because there are a lot of implications with the family in pediatric oncology. We actually did a study on the perception of the public regarding pediatric cancers. So what we found out is that most of I think probably 20-25% people believe that pediatric cancers are curable. That was the first revealing thing that there's very little, awareness.
Let me go back. So you said only 20% of people thought that it is curable. So 80% of this is a non-curable.
Exactly. Yeah. So actually, it's the reverse. It's highly curable, as we know. I'll give you an example. As I said, Wim's tumor, the cancer that occurs in the kidneys. So it's a highly curable cancer. Even if you detect it in stage 4, the curability is around 90-95%, which you can never think of in adult cancers. So pediatric cancers, if you see, majority of them are highly curable if detected in an early stage. Many of them do find it.
And then one thing you said yesterday is the impact of pandemic, right? Middle East,
yes.
Yeah.
So as everyone knows, our economics also always run on funds that come from outside. So majority from the Gulf and other states. So other countries.
Right, I think that's about it, and I really appreciate you taking time and talking to us. That I felt like that awareness is needed, that this is pediatric cancer is different from adult cancer. Curability is much high, especially if you can get the care. But the difference is it's an intense 2 to 2.5 year effort, and families are affected as a unit, and they need a collective help to get through that phase. And if they can, most likely the kid will survive and have a good life. So I just want to get that message across. Okay. Thank you very much.
It was great being part of your campaign.
Yeah, appreciate it.